Are you a millennial who has been working at a place for, let's say, 1 to 2 years, and you just feel a little itchy, you want to move to like a different unit or a different floor? Because if you're like that, you're just like me. Hey guys, this is Mitch of All Trades and welcome back to my channel. If you're new here, welcome. It's glad to see you. Make sure you subscribe, hit the subscribe button below and join the family. But if you're an oldie but a goodie, what's up? How are you? So this video is going to be talking about my transition from a med-surg trauma nurse to an ICU nurse. Yes, I'm starting a new position at a new unit. Same hospital though, but a new unit. And I know it's going to be a journey for me, but I'm excited. So for any of you guys that don't know, ICU stands for intensive care unit. This unit is for very sick patients with highest acuity who need a lot of care, a lot of attention, and it's more intense, like they say. So a lot of nurses, they really enjoy or they're really looking forward to be an ICU nurse or an emergency room nurse, because these are critical care nursing, which is more rewarding and I guess more exciting because you learn a lot and you're very involved in the patient's care. Now, there's also been some controversy because a lot of people will tell you to get some experience as a med-surg nurse before you move to the ICU, or some people might tell you that maybe you can just start off as a new grad applying to the ICU. To be honest, in my opinion, I would just say, do you, boo. Whatever it is that you want to do, whatever specialty you want to pursue it. If you want to go to the ICU right after college and they hire you for it, go for it. But if they don't and you have to start off in the med-surg floor, that is still perfectly fine. In the med-surg floor, you can still gain ground and still gain momentum and gain more experience that can carry you to the ICU. Like I said before, the intensive care unit, it's the high acuity of patients, and I'm going to be working in the surgical intensive care unit, which is called the SICU, also known as the trauma intensive care unit, the trauma ICU. And that's because it's kind of an extension of the med-surg trauma floor that I was working on before. And here is just going to be more sick patients. So trauma cases with like gunshot wounds and stabbings and falls and car accidents and being hit by a car and having your leg cut off and just all these crazy stuff. When they come into the hospital and they're just like fighting for their life, they're very, very ill, the injury is so severe, they come over to the ICU. Now this floor, you have to be very detailed, you have to be very organized. It's a lot going on because the skills are very specialized. You get extensive knowledge on a patient's injuries, a patient's diseases, and how it affects different parts of the body. So it's just very interesting and very cool. I've been wanting to pursue critical care nursing for a while, so I'm very glad and very grateful that I am able to start this new chapter of my life. Now in the ICU, the patient ratios is 2 patients to 1 or maybe 3 patients to 1, and that's because of how critical these patients are. It's definitely such a big difference and a big difference from where I was working before. As a trauma med-surg nurse, the patient ratio was 6 patients to 1, and when I was working in the step down, which is the middle ground between the med-surg and the ICU, the patient ratio was 4 patients to 1 nurse. One thing I loved about the med-surg floor was that the patients were more stable, the patients are more awake, and I'm able to interact with them more, talk with them, laugh with them, kiki, joke around with them, make them feel better, hear them of their needs and stuff. It was more interactive, and I really personally enjoyed that. Just for leisure, it was good vibes. But now I know that when I move to the ICU, most of these patients are going to be very sick. They're going to be too sick to talk. Most of them might be intubated. They may have a tube down their throat where they're not even able to speak. Most of them might be sedated where they are just asleep and they're just very sick. So I know it's going to be a big difference for me, but I mean, what's life without a little challenge, you feel me? And one thing I learned from my old unit is honestly the progression of health, the basics, the foundation of, patient care and the patient body and how different diseases affect them. It was more at a slower pace. So I gained more ground on nursing skills per se, and it helped me build momentum. But I know that now I am itching for a challenge where I can push myself forward, new challenges, new knowledge. So I'm excited for where I'm moving to now. So what are some skills that ICU nurses need? So ICU nursing, I believe you need to be more detailed, you need to be more organized, you need to be a multitasker, you need to be very alert to sudden changes that might happen, you need to be very quick. These are stuff you need to do. So, which is something I would say I am. I'm very detailed. I'm really attentive to detail. Like I'm into detail. Just for everything in life. Like I'm just into detail. So I feel like that's somewhere I would love to be. Somewhere where I have to be detailed. I have to be quick on my feet. I have to be more knowledgeable and stuff. So I'm excited for this new unit. Also, another thing with the ICU is that the doctors are involving you in patient care, because when you work with these patients, you're getting so much knowledge. You're open to so many knowledge, so many specialized skills, just so much that you've never seen before. So you're going to be more involved in their care more than you were before. So that's a plus. So my tip for any nursing students, any nurses, any new graduate students, I would say explore. Be open to exploring. You never know where life can bring you. You never know what you're gonna love till you explore everything. I would say for anyone that knew me before, like I was so for pediatrics. Like pediatric nursing was something I wanted to do. Even in nursing school, I wanted to be a pediatric nurse. I wanted to work with kids because I love kids. Like that was my home in my head. And after nursing school, I applied and no one was really hiring for peds. So I was just like, all right, I'm gonna have to switch something up. So that's when I moved to trauma nursing, and I actually love trauma. I love the critical aspect of it. I like the fast pace of it. I like the cases that I'm seeing and everything that I'm learning, the experiences that I'm getting, especially where I work. I love everything. So it's crazy how my mind was set on one thing, but obviously God had a different plan for me, and I'm still loving everything every step of the way. So I will always say to be open to anything, to explore. Just because you start off in one area doesn't mean you have to stay there. It makes it more fun. It helps reduce burnout, to be honest, because when you're doing the same thing over and over and over again, it becomes redundant and it can become boring. It can become less exciting. So I always would recommend exploring nursing. There's so many specialties to nursing. I think I will make a video later on about the many specialties that nursing comes with. And for me, I'm very adventurous, so this is something that I needed. So I know that even after ICU nursing, maybe after a couple years of doing it, when I feel like I've learned so much and gained so much, I might do something else. But I don't know what the future holds, so I'm always keeping an open mind. When you keep an open mind, it helps keep opportunities open for you. Always be willing to challenge yourself. To be honest, I'm excited, but I'm a little scared because it's a new environment. And I was feeling like a little intimidated, because I was like, I don't know, like, will I fit in? Would I learn? I don't want to make any mistake. But my coworkers, they were talking to me and they were telling me how they believe that I can do it, that I'm fit for it, and all this other stuff. And I was just like, honestly, if these people believe in me, why shouldn't I believe in myself? So that's something that I had to learn, like just keeping an open mind and also believing in yourself. So what are some things that I'm expecting from myself? Honestly, I really want to be more resourceful. I want to be more knowledgeable. I want to gain new knowledge. I just want to learn so much about health, about the body, about diseases, about injuries. I want to learn how different injuries affect different parts of the body, because that's what the ICU is going to be about. And I just feel like I want to hone on new skills. I want to perfect old skills. I just want to be resourceful, and yeah, I just want to be that nurse, just bomb. Okay, that's what I want to be. That's the goal. And I'm gonna keep you guys updated on everything that happens, if I end up liking it or not, if I quit or not. I'm gonna let you guys know. But for the meantime, enjoy this journey. I'm excited to start it. And yeah, if you have any questions for me about ICU or about the trauma or about any other thing about nursing as far as specialties or anything else in general, make sure to leave a comment below. I will answer it. I always answer everybody. I will check on it and everything. I hope you guys were blessed by this video. I hope it inspired you to do something. I hope it influenced you to do something. I hope it motivated you and encouraged you to do something about your nursing journey. Just stay fluid, just stay limitless, to be honest. And that's really the point of this video. All right. So thank you guys for watching. Make sure you like, comment, and subscribe, and I'll see you in my next video.